Welcome to breakout number 2, and this is this talk on diet and nutrition with Suzanne, Kaye. Thank you very much for being with us today. My name is Shelley, and I'm a education and support service coordinator at the Society, as well as the physiotherapist at the Society. So I will be here to help out in the session today, and I will be floating around at the back of the room. If you have any questions, you are welcome to come grab me, or you can give me a wave and I'll come over to you. So on your table, you should find that you have a feedback form as well as a take-home one sheet of paper with some key information that will be from this session today. So hopefully you'll see it. It should be in a bit of a pile in the middle of the table. So hopefully there are 2 sheets there for you, an evaluation form and then a take-home piece of paper as well. So at the end of the session, I'll ask you to fill out your feedback form, and you can just leave it on the table and we'll come collect it at the end. Your feedback's really valuable to us because we can use that to improve on our future sessions or to also bring brilliant speakers like Suzanne back. Okay, so Suzanne is a registered dietitian at For My Health Nutritional Consulting in Vancouver, and she will be doing this talk for us, and the talk will be roughly about 45 minutes with some time for a Q&A at the end. So if you do have any questions, please feel free to write them down so you can remember to ask them at the end. We'll have some time there. Okay, thank you everybody. Thanks for being here, and thank you, Suzanne.
Thank you, Shelley. It's nice to meet you all. Again, my name is Suzanne, and I'm a registered dietitian. I'm here to talk about diet and nutritional considerations for people with Parkinson's. So let's get right into things. I've got a lot of info, and hopefully I will be able to cover it all in the 45 minutes. So here's a brief outline of what I will be talking about. First, I want to take a minute to talk about the pathophysiology of Parkinson's, or PD, which is basically how we think it develops. A few key points I want to cover there. Then I'm going to spend some time talking about overall diet and specific nutritional factors in relation to brain health, Parkinson's development, and progression. After that, I'm going to cover a myriad of nutritional concerns in Parkinson's that can lead to malnutrition and weight loss, and what can potentially be done about those to help. And then I want to spend a bit of time talking about bone health. So before jumping right into the diet information, I just want to take the next minute or so to briefly discuss our current understanding of the processes that are involved in Parkinson's development. The reason being that points brought up later in the presentation will be applicable to different points in these processes depicted here, mainly the things in the red boxes, but a few of the blue ones as well. So you can see in the blue boxes the 4 core processes that are thought to be contributing to an end result of a diagnosis of Parkinson's. Alpha-synuclein protein misfolding and aggregation. You've got dysfunctional protein clearance of that misfolded protein. You've got mitochondrial dysfunction, which causes a critical reduction in cell energy, leading to brain cell death. And you've got neuroinflammation, which is basically inflammation in the brain. Yeah. Okay, I'll move the microphone. Is that better? Yes. Okay. Sorry. Okay. The reddish boxes in the upper corners represent some things that are thought to be triggering factors for some of these 4 core processes that are found in the blue. It's thought that dysbiosis in the gut, which is basically an imbalance of the healthy and unhealthy bacteria, and possibly toxins, can trigger the protein misfolding as well as the neuroinflammation. And it's thought that excessive oxidative stress from inflammation plays a part in both protein misfolding and the mitochondrial dysfunction. The things in the red boxes and some of the things in the blue boxes can be affected by our diet, as our next sections will uncover. Okay, so as I said, I'll be starting by talking about diet and nutritional factors in relation to Parkinson's development and progression. And I think it's important to highlight that this is still very much a growing body of information. The good news is that we definitely have learned a lot over the years, but unfortunately there's still a lot that we don't know. I saw this cartoon and I thought it was an appropriate way to lead off this section. Research suggests that the majority of people do choose to hear the bad news first when asked, so I will start with that and then we can spend lots of time focusing on the good news. So, the bad news first. Unfortunately, we don't know enough about diet to use it to cure or reverse the damage that's already done to the nervous system in Parkinson's. There are still a lot of gaps in our research base at this point, and there is not a single diet prescription that is right for everybody with Parkinson's. But the good news is that it does appear that diet has the potential to slow the development and the progression of Parkinson's and also ease the symptoms. I'll be honest, there's not a multitude of studies that have been done to this point that focus specifically on Parkinson's. However, the ones that have been done do show some encouraging results. And also, research is ongoing. For example, there's a study in progress right now that's looking at the effect of a Mediterranean diet intervention specifically on constipation, as well as how the diet changes markers of inflammation in the gastrointestinal tract, and also changes the microbiome, which means how it changes the different bacterial types that are present in the large intestine. So of the research results that I'm going to share, some were focused on different general aspects of brain health, like cognitive decline or brain inflammation, but these are relevant given that these happen in all neurodegenerative conditions, so the dietary strategies that slow these down can presumably help with Parkinson's. And where there's Parkinson-specific research, I will try to highlight that. So let's talk about diet. Diets that optimize brain health. What does the research say? So most of the research on overall dietary patterns so far has focused on 3 different diets. You've got the Mediterranean diet, the DASH diet, and the MIND diet. And this MIND diet is basically a combination of the Mediterranean and the DASH. So there have been positive results found for various measures of cognition and memory, Parkinson's development and progression, cognitive decline, and depression. The strongest evidence for general cognitive decline is probably for the MIND diet so far, and this diet also appears to delay the onset and the progression of Parkinson's. It's believed that these diets act by reducing inflammation by the things that they provide in abundance as well as the things that they limit, and they have a cumulative anti-inflammatory effect over a period of years. On a side note, these dietary patterns have also been found to reduce the risk of cardiovascular disease, presumably by the same mechanisms. So what does the MIND diet look like? Oh, yeah.
We can't hear you, so if you just slow down just a wee bit.
Okay.
Sure.
Sorry. Oh, okay.
We really want to hear what you have to say.
Okay.
So,
Is there anything you want me to review?
no, I think you're okay. We'll
Okay. I'm gonna. Okay. There. I'll stand closer. I apologize.
Not a problem. Okay.
So, what does the MIND diet look like? This is basically a summary. Now, the Mediterranean style diet is very similar. It's a little less specific as to the daily or weekly portions and the very specific foods, but the recommended foods are generally the same. So I'm going to focus on the MIND diet here. And your takeaway handout actually has a Mediterranean diet pyramid for your reference. The DASH diet is also represented by that pyramid. So these 10 foods are encouraged on the MIND diet in the serving amounts listed. And again, this is also on your takeaway handout. So you've got your green leafy vegetables topping the list. You've got all other vegetables included there. You've got berries, nuts, legumes, poultry, fish, whole grains, olive oil, and even red wine. Exactly. So in addition to encouraging a variety of healthy foods, the MIND diet specifically discourages these 5 foods, again, in the serving amounts listed. So you've got butter and stick margarine at less than a tablespoon a day, cheese around a serving a week, red meat less than 4 servings a week, fried fast food less than a serving a week, and pastries and sweets less than 5 servings a week. So why does it work? One theory is through its multitude of anti-inflammatory effects, which essentially act as a fire extinguisher to put out the fire of inflammation in a variety of ways. More inflammation equals more oxidative stress in the body, and oxidative stress was one of those red boxes from our chart at the beginning. So where does the anti-inflammatory effects come from? First, the abundance of plant foods provided by the diets equal a lot of antioxidants. And these These have direct effects in our body, as well as they turn on the body's production of our own very potent antioxidant systems. Next, the abundant omega-3 fats that are provided from seafood affect key inflammatory pathways. Also, a high monounsaturated fat diet has been associated with lower levels of inflammation. We get abundant monounsaturated fats from things like olive oil, nuts, seeds, and avocado found on the diets. An abundance of vitamins and minerals from real nutrient-dense foods can support the body's own anti-inflammatory pathways and metabolic pathways, basically keeping the body running efficiently. And the low glycemic nature of the diet helps avoid blood sugar spikes, which can create tissue damage and oxidative stress. Finally, the diet minimizes pro-inflammatory things like saturated fats, trans fats, sugar, and chemicals from highly processed foods. So in addition to its anti-inflammatory effects, another theory of why the Mediterranean or MIND diet works is because of how it supports gut health. And if you remember, that was one of our red boxes, the dysbiosis. So much research is starting to show the connection between gut health and brain health, and Parkinson's research is no exception. In fact, there appears to be a very strong connection in this case. There is two-way communication happening all the time. This is referred to as the gut-brain axis and is depicted in this picture. You can see that a normal or healthy gut flora supports regulated activity of the immune system, whereas an unhealthy gut flora, also known as dysbiosis, leads to increased susceptibility to inflammation and changes in the brain. Excess gut permeability seems to be a factor that tips the equation in favor of the inflammation path, and dysbiosis does increase gut permeability. Of note, studies with people with Parkinson's generally do show an increased level of permeability in these individuals. So the Mediterranean or MIND diet can also work by supporting our gut health. Where does this support come from? First, comes from the abundant fiber provided by all the plant foods. These fibers are also called prebiotics, and they selectively feed the good bacteria in the gut. It gives them the competitive edge over the bad ones. The fibers also support the production of a short-chain fatty acid called butyrate. This butyrate nourishes the cells of the large intestine and contributes to improve gut health by reducing inflammation and permeability. Butyrate also has anti-inflammatory actions throughout the body and in the brain, again targeting the oxidative stress red box from our diagram earlier. Second, the diets provide abundant polyphenols, which are the antioxidants, again from the plant foods, in addition to being the direct antioxidants for our use, which we did already talk about. They nourish the good bacteria as well, so we use them and the bacteria feed off of them. The pictures along the side of this slide are some of the best prebiotic foods, either because of the fiber or the polyphenols that they contain. And your take-home messages handout will have a more complete list included for you of all those great prebiotic foods. Finally, the diet supports gut health by being low in added sugar, since a high sugar intake can also contribute to dysbiosis. There's a couple additional mechanisms that the Mediterranean and MIND diets may be working through and are worth a quick mention. Some polyphenols can actually improve blood flow to the brain, which improves overall nutrient delivery. And polyphenols and omega-3 fats can have direct effects on neurotransmitter production and function. So that's things like your dopamine and your serotonin and the other ones. So I want to switch gears a little bit, still talking about diet, but the next diet I want to touch briefly on is the ketogenic diet. It's a diet that's very low in carbohydrates, it's high in fat, with modest amounts of protein. It induces a state of ketosis, where ketones are produced from fat as an alternative fuel to glucose. The brain can use these ketones for energy. As an aside, this diet's been used for many years as a management strategy for epilepsy that isn't responsive to medication. But more recently, there's been an interest in using it as a management strategy for both Parkinson's and Alzheimer's. owing to several mechanisms by which it can reduce dysfunction in these conditions. The research is still pretty new in this area and it's ongoing. There have been 3 studies done so far in Parkinson's, and they seem to show potential benefit for non-motor symptoms such as urinary frequency, pain, daytime sleepiness, and cognitive impairment. But more research is needed, definitely, to confirm this and also elaborate on what might be potentially helped with this diet and way of eating. So what does the ketogenic diet look like? So basically the foods eaten liberally are low carbohydrate. You've got oils like olive, avocado, and coconut. You've got avocados, butter, heavy cream, hard cheeses, nuts and seeds. You've got your non-starchy vegetables, so things like broccoli and lettuce and cucumbers and asparagus and things like that. Foods eaten sparingly are your protein foods, meat, seafood, and eggs. Basically, you're eating enough to meet your protein needs, but not more. And sometimes semi-starchy vegetables like carrots, onions, or squash. And then foods avoided would be your high carbohydrate foods like grains, really starchy vegetables, milk, yogurt, sweets, and fruits, except for avocado, lemon, lime, and small amounts of berries. So how does this diet work? Well, despite the fact that it appears very different than the Mediterranean DASH or MIND diet, it has actually been shown to have multiple neuroprotective effects. In other words, it can protect the brain in several different ways. The effects appear to happen first by increased energy production in the brain, because the ketones can sometimes actually be used easier than glucose. This targets one of the core blue boxes, if you remember back, the mitochondrial dysfunction. Mitochondria are the little energy-producing factories in our cells. Second, the action of some neurotransmitters is modified. And third, the use of ketones over glucose actually has several anti-inflammatory or antioxidant effects. I won't go into a lot of technical details about that, but this does target the oxidative stress red box from our diagram, and if someone wants to know, I can elaborate a little bit at the end. So while the ketogenic diet does have a lot of potential benefits for brain health, it's not without significant risk, and this must be weighed when deciding if it's worth a try or not. So for example, side effects of a high-fat intake can include slower gastric emptying, nausea, and constipation. These are often already issues for people with Parkinson's. Metabolic changes like increased cholesterol or triglycerides, electrolyte disturbances, dehydration, and even pancreatitis can occur if one is not careful. Due to the very restrictive nature, there is a higher risk of malnutrition, and people with Parkinson's are often already at higher risk of malnutrition. People with Parkinson's are also at higher risk of loss of muscle mass, and the diet makes getting adequate protein a little bit more difficult. And finally, the very restrictive nature also makes long-term sustainability an issue. So definitely some promising stuff here, but also things need to be weighed, the pros and cons. Okay, now I want to briefly talk about a couple other miscellaneous diet associations with specific foods or food components, the first one being dairy. Some population-based studies have found a slightly increased risk of development of Parkinson's associated with a higher dairy intake. Note that correlation does not equal causation, though, and we can't make the assumption that this is a straightforward relationship or that it's even true at this point without some stronger research data. Some studies did further divide this into milk and fermented dairy and found the association mainly with the milk, not cheese, yogurt, or butter. Theories of why this may be the case include pesticides found in milk and or the ability of dairy to lower uric acid, which is something that does have neuroprotective properties. It's also important to note that these studies looked at Parkinson's development, not the effect of dairy in people with Parkinson's already, and this effect is largely unknown, unfortunately. We also need to remember that dairy can be a really helpful source of easy to consume and concentrated nutrition and calories for people with Parkinson's. On the other hand, though, research on caffeine is definitely intriguing and encouraging. Multiple studies have shown association of caffeine intake with lower risk of Parkinson's, and some studies also show improvement of motor and psychological symptoms with caffeine intake. It appears caffeine reduces brain inflammation and is thought to be mainly through its actions on the adenosine receptors in the brain. This targets one of our blue boxes, the neuroinflammation. It may reduce the risk of developing dyskinesias associated with medications, and it may reduce cognitive deficits and dementia associated with Parkinson's progression. Newer research is even showing it may have effects through modifying gut bacteria and through the actions on the process of dysfunctional protein clearance. If you remember from our chart at the beginning, that targets one of the blue boxes and the red boxes. So that wraps up the first section on diet, and now I want to shift gears and talk about several nutritional concerns that are common in Parkinson's. Symptoms and nutritional concerns can vary quite a bit from person to person. In the early stages, concerns may be similar to that of the general population, for example, how to optimize brain health, prevent cardiovascular disease or diabetes, or maybe other chronic conditions. Later in the disease, however, weight loss and malnutrition can become increasingly common, and the causes can be multifactorial, meaning that the solutions or interventions may involve several different strategies. It's important to remember that diet strategies will need to be individualized based on the person, their most challenging symptoms, their priorities, their whole health picture, their diet preferences, and their swallowing abilities. So this depicts a common nutritional progression in Parkinson's. The time it takes for someone to move through the stages can vary, and ideally they can stay near the top for a long time. So in the first box, you can see that the foundational lifestyle should probably include a high-fiber, Mediterranean-style diet and regular physical activity. This will hopefully do all the good things mentioned in the previous section: slow overall disease progression and optimize bowel function. When symptoms worsen and medications either start or increase, protein redistribution is sometimes helpful or needed, but hopefully one is able to maintain a lot of the Mediterranean diet principles and exercise as able. If or when symptoms worsen further, you can sometimes see poor appetite or food avoidance. This can decrease nutritional status, and this is when you may start to see high-calorie food ideas necessary, or texture modification, a shift to more liquids, and the use of nutritional supplements. If things continue to worsen, sometimes a gastrostomy tube is considered. This is tube feeding, either as a supplement to oral intake or as a sole source of nutrition. So this slide is aiming to identify the main risk factors for the development of weight loss and malnutrition, which is where I'm going to focus in the next section. As you can see, there are several risk factors identified in the blue boxes. We've got altered gastrointestinal function, medication side effects, reduced ability to shop and cook, reduced sense of taste or smell, food medication interactions, and increased energy needs. So in the next number of slides, I'm going to aim to outline each of these in further detail and provide some possible solutions. So starting with the increased energy needs or weight loss concerns, dyskinesias, tremors, and rigidity are thought to increase energy needs, and a recent study did actually demonstrate a higher resting metabolic rate in people with Parkinson's compared to healthy individuals. It's often harder for people with Parkinson's to meet their increased energy needs due to other factors at play, for example, gastrointestinal symptoms, medication interactions, swallowing issues, etc. For these reasons, a diet that includes healthy, energy-dense food is often recommended to combat undesired weight loss. So what are some of these foods? Well, fat is the most energy-dense nutrient, so we typically encourage more generous amounts of foods that are high in healthy fats to really give the diet a calorie boost. Luckily, a lot of these foods come with other valuable vitamins and minerals, and sometimes fiber as well. So we've got things like avocado, nut and seed-based products, either whole or the butters as tolerated, hemp hearts, ground flax seeds, healthy oils like olive and avocado, olive or avocado oil-based mayonnaise, and higher fat dairy products like cheese and higher fat yogurt. Deficiencies of micronutrients, which are vitamins and minerals, It's certainly possible if one is losing weight and becoming malnourished, but these should be assessed on an individual basis, as we cannot make blanket statements about one would need to be supplemented with. It could include any combination of vitamins or minerals based on that person's current food preferences and avoidances, as well as that individual's microbiome and overall health picture. Sometimes specific supplements or a general multivitamin may be indicated, but like I said, it's best to sort of assess each person individually and see where their strengths and weaknesses are. The next risk factor on the list is gastrointestinal concerns, of which there can be several. There can be dysfunction along the entire gastrointestinal tract with significant impacts on quality of life. These include swallowing difficulty or dysphagia, delayed stomach emptying, small intestinal bacterial overgrowth, and constipation. So starting with swallowing concerns, the technical term for this is dysphagia, and over 80% of people with Parkinson's will experience some level of swallowing difficulty at some point. It's much more common as the disease progresses past 10 years, and dysphagia can present differently in different people, and this is because the cause is multifactorial. The loss of dopamine can play a part, but damage to other parts of the brain's stem also appears to be involved. Parkinson's medication sometimes helps, but not always. So this slide depicts the phases of swallowing. The food is in the green, and you can see it starts in the mouth, moving to the back of the throat, which involves some voluntary muscle movements. Once it hits the back of the throat in B, the swallowing reflex kicks in and generates a swallow that carries the food from B down past the airway in C and D and into the esophagus, and then down to the stomach. As you can see here, this depicts a normal swallow because all of the green stayed together. None stayed behind in the throat or went into the airway, which is the tube in front of the tube that the green is following. So this is another picture showing a part of the same process. It's showing the difference between a normal swallow, which is the first picture, where the green food goes down the esophagus, and an abnormal swallow, or in this case, aspiration, which is shown in the second picture. This is where food or liquid goes into the airway during a swallow, shown in the second picture. Aspiration is one of the things that can happen when someone has dysphagia. There are many other parts of the swallow that can potentially go wrong as well, right from chewing to getting the food into the stomach. Some of the most common things that are seen in Parkinson's are a delay in being able to move the food to the back of the throat, repetitive tongue movements, food being left over in the throat after you swallow, and aspiration. The esophagus can also sometimes have problems in moving the food to the stomach. If someone's having problems swallowing, for example, noticing food feels like it's getting stuck or lots of coughing during meals, it's best to get a formal swallowing assessment, and this is done by a speech-language pathologist, or SLP. They can actually do a swallowing test where through x-rays, they can watch a person chew and swallow foods and identify exactly where the problems are happening. They can then often offer strategies that may help make eating and drinking easier. There are several swallowing clinics in the Lower Mainland and throughout the province that doctors can refer patients to where this type of assessment can be done. So let's talk a bit about those techniques. The management of dysphagia in Parkinson's, again, it needs to be individualized based on the symptoms. As I mentioned, Parkinson's medications sometimes may help, but not always, and deep brain stimulation, unfortunately, has not proven terribly helpful either. So some of the strategies that can be helpful include adjustment of body position, for example, a chin tuck, which looks like this. This narrows the entrance of the airway and can help prevent aspiration. It also can reduce leftover food in the throat. A head tilt or turn, which can help this helps optimize the food's path through the throat. And some of the actual diet recommendations might be a soft, minced, or pureed diet. This compensates for impaired chewing. Pureed diet can also compensate for difficulty forming the food into a cohesive mass in preparation for swallowing. Added moisture is sometimes helpful. This can compensate for general weakness, and it helps the food to go down a little easier. And adding thickness either to solids or to liquids, thickening liquids. This improves the cohesiveness of the food and slows the transport speed a little bit, which gives the body a chance for that needed swallow reflex to kick in. Finally, some compensatory techniques include repeated swallows, that's swallowing more than once for every bite of food. This reduces the amount of residue left in the throat, and alternating in liquids and solids. This helps trigger the swallowing reflex, and it also reduces the residue left in the throat as well. In addition, there's actually a couple rehabilitation methods which have been studied in Parkinson's and shown to have some potential benefit for swallowing. First, you have EMST, stands for Expiratory Muscle Strength Training. It's a behavioral treatment paradigm which uses a pressure threshold device and a controlled treatment protocol to strengthen the muscles involved in breathing out. This increased strength may lead to functional improvements in cough and swallow. And then secondly, you've got the Lee-Silverman voice treatment. It's a behavioral therapy that aims to help people relearn what normal voice and movement feels like. These things tend to get smaller during the disease course, and the program has loud and big components aimed at retraining the brain and improving function. Improved swallowing function is sometimes a side effect of this type of training, and I did actually see a table outside there with some information on that. Maybe worth picking up a brochure there. So moving down the gut, we come to the stomach. Delayed gastric emptying is somewhat common in Parkinson's. It can be caused by a medication side effect as well as dysfunction of the nervous system. It can cause the sensation of feeling full very quickly, nausea, reflux, vomiting, and medication absorption issues. It's mainly an issue with solid foods. Liquids seem to be much better tolerated. Medication can sometimes help. Domperidone is the most common one currently used, and it can be fairly effective. Prucalopride is another medication that can help, but it does have significant risk of heart side effects, and it's not typically covered by insurance plans, so we don't see it used very often. Diet modifications that can help with the gastric emptying include smaller, more frequent meals and snacks, lowering fat and fiber intake. This obviously needs a balance because you've also got the concerns with malnutrition and constipation, but sometimes you can find that happy medium. And intake of caloric liquids like soups or smoothies, again, because the liquids seem to pass through a little easier, so it can optimize intake that way. Moving down again, we've got the small intestine and a condition called small intestinal bacterial overgrowth. This is a condition where larger than normal numbers of bacteria are growing in the small intestine. It can cause a variety of issues that include nutrient malabsorption, bloating, gas, constipation, and or diarrhea. Studies have actually found high rates of positive SIBO tests in people with Parkinson's, and the slowed gut transit time in Parkinson's is thought to be a risk factor for the development of this condition. The presence of SIBO has actually been associated with worse motor symptoms. Treatment, if one is diagnosed, typically involves a very specific antibiotic called rifaximin. And finally, we have constipation. Constipation is present in at least 80% of people with Parkinson's and often present 1 to 2 decades before the motor symptoms appear. The cause is thought to be multifactorial. You've got damage to the nervous system of the gut. The microbiome appears to be altered in Parkinson's. The condition of dysbiosis that we talked about earlier. Gut inflammation is increased by this, which causes changes in motility. Constipation can also be a side effect of some of the drugs that are used in Parkinson's treatment. And things like less physical activity and dehydration, which are a little more common in Parkinson's, can also be contributors to constipation. So what can be done about constipation? Well, there's a number of different approaches that can be combined to hopefully find some significant relief. First, there are foundational things that we would recommend for pretty much anyone struggling with this issue. A high-fiber diet with plenty of fluid is pretty foundational, and a Mediterranean-style diet like we discussed earlier, certainly lends itself well to easily achieving this with its generous fruits, vegetables, whole grains, nuts, seeds, and legumes. Regular physical activity is also key for gut motility and also beneficial for keeping muscles strong. Standard non-stimulant laxatives are also a mainstay if diet and exercise are not enough. You've got things like PEG or lactulose, stool softeners, or even something like magnesium. There are some newer emerging strategies that can also potentially be tapped into, and which I'll go into a little further in the coming slides. These include microbiome manipulation, deep brain stimulation, and a couple newer medications. So probiotics are the good bacteria that do helpful things in our gut. Research in animals and humans tells us that probiotics can improve gut and body health by a multitude of different mechanisms, all of which appear to be affected in Parkinson's. These include improving gut barrier integrity, which again is compromised in Parkinson's. This reduces brain inflammation. Probiotics can regulate the immune system. They reduce inflammation locally in the gut. They suppress the growth of bad bacteria. They moderate intestinal motility, and they can even improve mood. This means, hypothetically, there's much benefit to be had by probiotic supplements in Parkinson's. However, unfortunately, only a few studies have actually been done in people with Parkinson's so far. This next slide summarizes the state of that research thus far. So again, only a handful of studies have looked at probiotic supplements in Parkinson's patients, but the good news is that they have found benefits, including improved stool consistency and frequency, improvements in overall symptom scores, and reductions in markers of oxidative stress. Insulin functioning was also improved in one of those studies. Animal models of Parkinson's have looked at probiotic supplements in relation to a more extensive list of symptoms because they can actually look at the brain in these situations. And they've found brain protective effects and slowed progression of symptoms. So this is all definitely very encouraging, but more work still needs to be done. Next, I want to touch briefly on prebiotics, which I already mentioned in the diet section, and which are basically the food that the probiotics thrive on. They're a food that selectively feeds the good guys, giving them an advantage over the less desirable bugs. They include things like fructooligosaccharides, galactooligosaccharides, resistant starch, inulin, and fructans, which are different types of carbohydrates that humans can't digest, but they're found in the foods that we eat. If you remember from earlier in the presentation, I mentioned these as things that are provided in relative abundance on a Mediterranean-style diet that's high in fruits, vegetables, legumes, nuts, seeds, and whole grains. These things nourish the good bacteria and help them grow. And another thing that happens is the good bacteria turns these into the short-chain fatty acids, like the butyrate that I mentioned earlier. This creates an acid pH in the colon that inhibits bad bacteria. Butyrate also feeds the colon cells and improves gut integrity, reducing inflammation and maintaining balanced immune function. A final quick note, symbiotics are basically supplements that combine probiotics with prebiotics. The combinations have sometimes been shown to be more effective than either supplement on their own. So next I'm briefly going to mention some of the newer medications that have appeared. Drug companies continue to try and come up with new alternatives to the standard laxatives that we currently use. Again, that prucalopride that I mentioned is one recent addition that does appear to work well on constipation as well as the delayed gastric emptying. Unfortunately, as I said, there is significant risk of heart arrhythmia as a side effect, and it's not typically covered by medical plans. Linaclotide is another medication that's shown good results in constipation, also not typically covered by medical plans at this point. So this may not give us wonderful alternatives right away, but it's good to know that some alternatives exist, and it does show us that research is continuing. Deep brain stimulation is a newer therapy as well. It's mainly effective for control of certain motor symptoms, like tremor, motor fluctuations, and disabling dyskinesias. Some evidence suggests it may also help with constipation, though more research is needed to clarify this, as there have not been many studies done, and some of the results are hopeful but not consistent yet. So I'm just going to show this slide again to show where we're at. We've covered the increased energy needs and altered gastrointestinal function. I'm going to move on to the remaining ones, which will be a little shorter than the other ones were. With respect to medication side effects, levodopa and dopamine agonists like pramipexole have common side effects that have nutritional implications, such as nausea, vomiting, and constipation. Strategies to minimize these include some things that we already discussed in the stomach and constipation sections, but in addition, there's some things that we can do with medication timing and combinations. For example, levodopa dose can potentially be reduced by using it with other supporting medications that extend its activity time. For example, the carbidopa that's included in Sinemet, entacapone, MAO-B inhibitors, and extra carbidopa, as well as using protein redistribution. Potentially taking medication with food, although a food that's not high in protein can sometimes help, and the laxative medications and domperidone that I mentioned earlier. In terms of food and medication interaction, the main issue again is levodopa, and it should be taken ideally on an empty stomach 30 to 60 minutes before a meal, or at least 2 hours after to optimize its effects. The biggest interaction is with protein because of competition with certain amino acids. Low protein diets, however, are not recommended as they can cause malnutrition and weight loss, but protein redistribution, which is typically a low protein diet throughout the day compensated for by a high protein dinner, can help minimize motor fluctuations. It's worth noting though that while on a protein redistributed diet, the risk of dyskinesia development is increased, and in some patients, levodopa doses are reduced because of the better absorption, and they're required to prevent the dyskinesias. A few other nutrients have been shown to potentially interact with levodopa as well, although to a lesser degree than protein. First, a high fiber diet actually appears to improve effectiveness, possibly through the improvement of constipation and or stabilized absorption of the medication. Second, some studies show caffeine may quicken absorption and possibly reduce the dyskinesias, like I mentioned earlier, although more research is still needed to confirm this. And third, vitamin C actually may improve absorption for people with poor initial levodopa response, but again, more research is needed here. So moving on, we have a reduced sense of taste or smell, which can make eating less pleasurable. Some things that can potentially help with this are to spice things up using aromatic herbs and spices, trying spicy things like chili powder or hot sauces, marinating meats, using vinegars or citrus juices on a variety of things, using really flavorful additions to your food like cheese or toasted nuts, exploring different textures, trying different temperatures to see if it makes a difference. For some people it does, and paying attention to food presentation because we all like to eat things that look pretty. And then finally, the reduced ability to cook and shop. A variety of supports may be available to people who can no longer do this for themselves, for example, family and friends, paid supports, or home care services. And there's also a plethora of meal delivery services now that can certainly provide alternative options. Okay, I do want to talk about bone health, but I realize we're almost at 3:45, so should I keep going?
You have 2 minutes left.
Okay, I'll try really fast. Sorry. So people with Parkinson's are definitely at higher risk of osteopenia and osteoporosis, which is low bone density. Again, the cause is thought to be multifactorial. You've got reduced activity and mobility, malnutrition leading to a variety of nutrient deficiencies, and high homocysteine levels. Almost all the essential vitamins and minerals that we need to live are actually involved in building strong bones. However, some of them are much easier to get in adequate amounts than others. So the ones that are harder to get and that I'm going to focus on are protein, calcium, vitamin D, magnesium, vitamin K2, and fruits and vegetables. So starting with protein, research shows a positive association with higher protein intake and stronger bones, providing other nutrients like calcium are adequate in the diet. There's been a belief held for a while that high protein diets are detrimental to bone health due to increased acidity in the body and calcium leaching. But this is proven to be untrue. Higher protein intakes actually increase calcium absorption. Bone is 40 to 50% protein. It makes up the matrix that holds the calcium and other minerals, highlighting why it would be quite important. And protein is also important for keeping muscles strong. So, protein can significantly contribute to lower fracture risk, which is the desired outcome, by doing three things. It provides bone building blocks, it helps ensure adequate calcium absorption, and it helps keep your muscles strong. So the next logical question is, how much protein does one need? Studies are extremely variable at this point, but the general consensus is that protein intakes above the DRI, which is a basic minimum of 0.8 grams per kilogram per day, show beneficial effects. Benefits were seen in several studies in the range of 1.1 to 1.6 grams per kilogram, depending on what variables were looked at. To put this in perspective, someone who weighs 150 pounds, which is 68 kilograms, should definitely be aiming for more than 55 grams and probably closer to 75 as a reasonable target. An example of a daily intake that provides 75 grams would be a chicken breast or other piece of meat, a serving of dairy, 2 eggs, a handful of nuts, 6 servings of whole grains, 4 servings of vegetables, and a couple of fruits. This list shows some typical serving sizes for different foods and their protein content. You can see that where you get the biggest bang for your buck in terms of protein density is meat and seafood, with Greek yogurt, cottage and ricotta cheese, and tofu following not too far behind. The next nutrient I want to talk about is calcium. I think we all know calcium is important for building strong bones, and it makes sense. Almost 40% of our bone is calcium. We need about 1,000 to 1,200 milligrams of calcium a day, which is not a small amount. So it's definitely important to include some calcium-rich foods regularly, or take a supplement if that's not possible for some reason. So this is some of your top sources. You can see dairy products, milk alternatives like almond, oat, and cashew milk, and tofu. And canned salmon and sardines with bones are probably your richest sources. Collard greens or bok choy, tahini and blackstrap molasses are also worth noting. And then this next slide, I can go back to some slides if people want to look again. This next slide also has some honorable mentions, a little less dense than the previous slide, but still can contribute significant amounts. So you've got almonds, sunflower seeds, oranges, broccoli, kale, squash, chickpeas, white beans, chia seeds, flax seeds, and figs. Vitamin D is another very important nutrient for bone health. It does this through a variety of things, ways that it acts in the body. We can get vitamin D from sun exposure during months when the sun is strong enough. For us, this is roughly April to October. But since the sun is not a consistent source for most people, due to the seasons, use of sunscreen, or lack of going outdoors, it's recommended we get some vitamin D from our diet or supplements. Dietary sources are few. Basically, we're limited to fortified milk and alternatives, fatty fish, liver, and egg yolks. And since the recommended intakes vary from 600 to 1,000 units per day, and it's pretty hard to get from diet, a lot of people just choose to take a daily supplement that provides this, which is totally fine. On to the next nutrient, which is magnesium. Magnesium, again, contributes to bone health in a variety of ways. It works with the enzymes, it's part of the actual bone mineral matrix, and it interacts with the cells in bone that are constantly building and remodeling. The recommended intake is anywhere from 320 to 420 milligrams per day. That's men versus women. And the main dietary sources are things like nuts and seeds. Pumpkin seeds are by far the best source if you want to focus on one, and chia seeds are close behind. Legumes, leafy greens, whole grains, and some fish and dairy products also provide significant amounts.
Sorry, Suzanne, we're
Yeah.
out of time.
Okay.
We have just a few minutes for Q&A, so we'll come around with the microphone. If you have a question, you're welcome to raise your hand, and then we'll head to you with the microphone so everyone can hear your question. I'm so sorry to interrupt.
It's okay.
You had mentioned probiotics. Yep.
Yeah.
What would be a daily dosage?
That's a hard question to answer because it really depends on the strain. So there's many different strains of probiotics. You've got your Lactobacillus acidophilus, you've got bifidobacteria in various strains, you've got some of your soil-based probiotics. So the studies use different doses based on the different bacteria. So when I look for a probiotic, I try to find one that has actually been studied, and then I use like the dose that was used in this study that showed beneficial effects. And there's several of those. But if that's not an option, or you don't know how to look for the studies or whatever, I would say anywhere from 10 to 50 billion would probably be a reasonable dose. The soil-based probiotics, which are things that start with the word bacillus, you can tend to get away with a lower dose of those ones. Anywhere from like 1 to 10 billion would be a more common. I hope that helps.
So when you take a level carb or whatever, it's recommended you don't take protein with it, with the medication when you take your pill. What is really a protein? Like, is it a couple of nuts? Is that, I'm sorry, a bit of yogurt? That's always,
Yeah.
you're trying to get your protein and your probiotics, but how do you fit them in?
Yeah. Well, I think if you're trying to take your if you take your medication prior to eating, like on an empty stomach, I think that will optimize the absorption. And then whatever you eat like an hour later shouldn't really affect it nearly as much. Again, everybody is really different. I've seen some people who are super sensitive and other people who seem to get really good results with their levodopa. So if you are going to eat a protein close to it, I would say if it's under, 5 or 10 grams per serving, you might be able to get away with it. So a couple nuts is probably fine. Yogurt, it depends if it's the Greek yogurt or the regular yogurt, because the Greek is a lot higher, and also your portion size. But I would say experiment for yourself and see what you find.
Hi there. I'm just curious if one type of yogurt is better than another for the probiotics, like soy yogurt over Activia or something?
Again, every yogurt kind of uses different bacteria in their processes. Like Activia, for example, uses a very specific strain that's different than any other yogurt you're going to get. And their strain was specifically studied for constipation. So Activia might be a good yogurt for someone struggling with constipation. Otherwise, I would probably look for like what the label actually says on the yogurt. If it says probiotic yogurt, then it's going to have maybe higher numbers of like a good strain. Kefir, if you like kefir, also tends to have higher probiotic doses per serving than the regular yogurts. But again, it's so hard to say because every product is different. And with like the soy yogurt or oat yogurt, check the label and see if it has like active bacterial cultures, if possible. You're welcome. K2, very, very briefly.
Yes, please go for it. Yeah.
Like I only have a few slides left.
That's fine.
Okay. Oh, good. I like vitamin K too. It's an ignored vitamin, and I'm really happy to be able to mention it. So K2 actually works with two separate enzymes to help build bone. It also activates an enzyme that inhibits vascular calcification, which is a risk factor for vascular disease, dementia, kidney disease, and stroke. So to put it simply, K2 actually helps calcium get where it's supposed to go and prevents it from building up where it shouldn't. It works with vitamin D in conjunction with vitamin D to help do that. It's important to note because the bacteria in our gut does produce some K2, but it's quite variable from person to person, and we can convert some K1, which is from green veggies, to K2, but not really enough to optimize our levels. At least that's what we currently believe. And like vitamin D, there are very few sources of vitamin K2. Natto, which is a fermented soybean product, is by far the richest source, and a tablespoon or two of that a day will give you your daily dose. But the rest of the sources in the diet, which are things like chicken, egg yolks, certain cheeses, beef liver, raw sauerkraut, and butter actually have sort of really small amounts, so it's quite hard to get enough. I often actually suggest people, if they're supplementing vitamin D already, look for a product that has vitamin K2 included. Again, because they work together in the body, and neither of them are really easy to get in adequate amounts in the diet. Fruits and vegetables reduce the risk of a variety of chronic health conditions and improve overall health, but we don't really think of them as like building strong bones. It's interesting though, because research suggests that a diet high in fruits and vegetables can also help protect bone. The exact reason is not quite known, but theories include the alkalizing effects that they have in the body. This reduces calcium losses, and antioxidant properties. This reduces oxidative stress. So in addition to being good for the Parkinson's itself, if you see this diagram right here, oxidative stress has positive effects on, or I guess has negative effects on bone because it increases bone breakdown and it decreases bone building, whereas antioxidants do the opposite. And the fruits and vegetables have lots of the antioxidants. Final note on something called homocysteine. It's an amino acid that is part of certain cycles in our metabolism. It's created by certain processes and then it's recycled in our body by certain vitamins. In excess, though, it can create problems. It increases oxidative stress, including the actions mentioned on the previous slide. It also appears to increase degradation of the bone matrix, and if its effects on blood vessels, which it damages, can reduce blood flow to bone and the brain. Treatment with levodopa actually increases homocysteine levels because it's a breakdown product of the levodopa. So high homocysteine levels can further be exacerbated by deficiencies of any of your B vitamins like B6, B12, and folate because they're needed for that recycling. So ensuring adequate amounts of these B vitamins can also lower levels, or potentially taking a supplement if the diet is struggling. I can mention a few sources if anybody's interested of any of those, but the list was long, so I can also stop talking if I need to, but that was basically that was it.